It's literally like a flu shot. It doesn't hurt.
With COVID, we see endless opportunities to do things better.
It's a race against time to distribute the COVID vaccine, as more than 1,000 people in King County have died from COVID-19, close to 400,000 nationwide.
There's a lot of work to do in a very short amount of time.
Why is it taking so long to get the vaccines to the public? And how will the most underserved get access?
We're going to have to work harder.
Our panel of experts weighs in.
We're really relying on that community outreach.
Taking a shot at understanding the complications of vaccination. Next on City Inside Out. Welcome to this edition of City Inside Out. I'm your host, Brian Callanan. The rollout of vaccines to fight COVID-19 is a worldwide problem, putting a major strain on health systems at the local level. Our state and county health departments are scrambling to give the vaccine to as many people as possible, as quickly as possible, to build our immunity to the virus. But health officials are struggling, with some people who may try to cheat the system to get vaccines before those with serious health problems, and others who refuse to get the vaccine at all. Add in some growing concerns about COVID for homeless people in our region, and you've got a crisis on top of a pandemic that needs a serious shot in the arm. Frances Nguyen didn't feel much of anything when she got her first dose of the COVID vaccine at the Holly Park Medical and Dental Clinic in southeast Seattle.
I literally feel like a flu shot. Yeah, but it's not as painful as I thought it would be.
But this dental assistant did get a side effect, a sense of relief. She's one of 60 staff members at Holly Park, interacting with almost 9,000 patients a year during a pandemic that, as of mid-January, has killed nearly 400,000 people nationwide.
And I just wanted to feel more safe with the vaccine, just for like an extra precaution.
The rollout of the vaccine in our state, as with others, has been slow. About 15,000 doses are getting administered in Washington every day, and the Department of Health wants to triple that.
So there's a lot of work to do in a very short amount of time.
Michele Roberts is the DOH's Assistant Secretary for Prevention and Community Health. She says our state is trying to administer an unprecedented amount of vaccine as quickly as possible as we emerge from a multifaceted crisis.
Today, to that end, we are announcing a new plan.
The governor's Healthy Washington framework allows regions of our state to begin to reopen parts of the economy as vaccines are distributed and cases begin to drop.
We've got this third wave, the current wave, that continues to be very challenging for all of us.
And the state's new Secretary of Health, working with local clinics like International Community Health Services in Seattle, is trying to keep Washington's efforts to control COVID on track, but it's not without some pushback.
We know people have questions and concerns.
A recent statewide poll shows just over half of Washingtonians intend to get COVID vaccinations, far short of a 70% goal for so-called herd immunity. The DOH says it's dealing with cultural barriers of mistrust, from immigrants to thousands of black people from the U.S. involuntarily used as medical test cases in the past.
We want to make sure that people have answers to their questions and concerns because everybody needs to make a choice about whether to be vaccinated for themselves.
But those choices get a lot more complex for some of our region's most marginalized people.
The point of a vaccination campaign is to protect all of us.
Alison Eisinger is Exec.Director of the Seattle-King County Coalition on Homelessness, who says a recent rise in COVID cases for homeless people locally should not be a surprise, as a surge in cases grips our entire country this winter. She's hopeful that guidance from King County's Pandemic and Racism Community Advisory Group and the state's plan to vaccinate homeless people by April will help our region reach the goal of true public health.
And just as we do additional work to ensure we're reaching people who may speak languages other than English, or reaching people who may not have internet connection, we have to make sure that we are reaching people who are experiencing homelessness.
The state faces mounting pressure to create an equitable way to distribute its vaccine supply, with counties and cities stepping up to try to speed up delivery to a waiting public. In the end, healthcare workers at the ICHS want to inject a sense of the common good into the coronavirus conversation as the fight against this deadly disease enters a new year.
It will take all of us. It will take all of us to fight COVID and beat COVID.
Well, we have some questions, and the doctors are in. We are joined by Dr. Jeff Duchin. He is the health officer for Public Health, Seattle and King County. We also have with us Dr. Asqual Getaneh. She is the Chief Medical Officer for International Community Health Services, ICHS, here in the Seattle and King County area. Welcome to both of you. And Dr. Duchin, let me start with you here. A few days before we recorded this show, the federal government basically imploded the plans for the states in the U.S. when it comes to vaccine distributions. They want to get more doses out. I'm trying to figure out how this affects us.
The federal government issues guidance to the states, and the states are authorized to implement that guidance in the way that makes most sense in their communities. So here in Washington State, they have the responsibility to create guidelines based on the federal recommendations for our communities. And our guidance locally is informed by those federal frameworks, but they're not necessary to adhere to, exactly. So we will work with our state health department, provide them the input that we can to make the best recommendations using that federal guidance as we can for our own communities.
Yeah, I know there's been a lot of scrambling going on there, so I appreciate that. Dr. Getaneh, I know you recently met with our state's health secretary here, so help us understand what you talked about with him and what this is like at the ground level. I know that ICHS has 11 medical and dental facilities around King County caring for people of many different cultures here. Are you getting enough vaccine, too much vaccine? You don't have ways to store it? We've heard reports like that around the country. I'd like to know what's going on at ICHS.
We have received about 1,000 doses of the Moderna vaccine and have gone through about 750 of those in accordance with the guidance from Department of Health. We've included most of the frontline and patient-facing staff as well as other healthcare workers. We are poised to include our patient population. Yes, we have about 11 sites. About 6 of them have been approved for vaccine administration sites. We have a risk stratification tool that we've used to figure out which patient population should go first. We have about 1,000 or about 1,100 patients that are just above age 80, let alone above age 65. So we have a large population that is above age 65. So we're poised to vaccinate as many people as we can in a very short period of time.
Okay. Thank you very much for that. I want to go back to Dr. Duchin here and just talk about what King County's doing. Talking about setting up 2 mass vaccination sites by the start of February. And now we're also hearing the Seattle Fire Department's helping out too. Firefighters are going door to door to adult family homes to vaccinate people as well. With this whole mass vaccination plan, 2 questions here. Are we talking about using Seattle sports stadiums or something of that scale? And do we have enough personnel to administer the vaccine at that scale?
Yeah, thank you for the question. So the large-scale vaccination strategy is being built as we speak. We're working in collaboration with the business community and other private sector stakeholders, as well as Washington State Department of Health and in our healthcare systems to find locations, to develop staffing plans. Not only do we need people to administer the vaccines, but to register patients and to monitor them after vaccination and to provide appointments and answer questions, screen for eligibility and so on. All that needs to be done up front. So this is a work in progress. I can't tell you exactly where they're going to be, but they will be large facilities like stadiums or warehouses. There's a possibility we can do something similar to what we have for our large high throughput testing centers in South King County. We have done some mobile vaccination clinics early on to provide vaccine to high-risk healthcare workers and long-term care facility staff. So those are the types of things that we're thinking about, and we hope to solidify those plans and start putting them together in the next few weeks so that they can be open in February.
Okay, thank you very much for that. Dr. Getaneh, back to you here. I want to talk to you about some of these challenges in delivering more vaccines. I visited ICHS recently to see some of your staff getting vaccinated, and it's really not a simple process. People get the shots, and then they have to wait under medical observation for 15 minutes or so to see if they have a reaction. I want to ask you two questions, too. Can you speed up this process somehow? And do you have enough personnel properly trained to try to make this happen?
We do have trained personnel. We're likely to take personnel from their usual tasks to deploy them to vaccinate. We can vaccinate 15 patients in about an hour. So if we deploy 3 to 4 individuals at each one of our sites, we can potentially vaccinate many of our patients in a very short period of time. Again, we don't have excess staff, so we will have to repurpose our current staff, and that would require us to close potentially our clinic for regular patient care.
Okay, that's an important piece to point out. We'll follow up on that. But Dr. Getaneh, let me stay with you here for another issue. A big concern for health officials is building trust in the vaccine. We had this recent Elway poll showing just 55% of the people in our state actually plan to be vaccinated. At ICHS, I know more than half your patients need translation services, so there are some cultural barriers that you're dealing with there. And I'm looking at the BIPOC community, made up of some of the people who are hit hardest by this virus. How can you get them to trust the vaccine that could really help them so much?
Yeah, absolutely. That's a big concern of ours. I am going to count on what we have experienced even with our healthcare workforce. Initially, when we surveyed them, about 30% of them had said, no, I'm going to wait. I'm not going to get vaccinated immediately. And our clinicians and other staff, nursing, the ones that were vaccinated initially, started sharing their experience. And one individual in particular, Dr. Abrams, who had one of the first testimonials, shared with us her vaccination experience. And some of our staff members who are pregnant, who got vaccinated, helped a great deal to convince our staff members on the safety of the vaccines themselves. We hope that we are going to reach the community through our community outreach, community health workers, our community partners and leaders in the community to get an integrity bias, an integrity trust, meaning that individuals that are seen as trusted leaders within the community, whether it's the clergy or whether it is community-based organization leaders, development workers who can then be the first group that will be vaccinated potentially and share their experience with the others. So we're really relying on that community outreach.
Thank you for that. And Dr. Duchin, I'll head to you here because this whole idea of building trust is a pretty complex issue. I referenced in the setup piece to this show the Tuskegee study where hundreds of black men in the U.S. were involuntarily used in a medical study. And a Pew study has shown only about 4 out of 10 black Americans want to be vaccinated. So, and that's just really one issue here. I'm talking about this idea of trying to reach a vaccination rate of 70%, that goal to get herd immunity when we have this kind of pushback here. We're talking about people who are not necessarily recent immigrants, but who simply don't trust the system in our country. What do you say to them?
Well, first of all, I say thank you to Dr. Getaneh and her team because they're doing exactly what we need to do to reach out and understand people's concerns. What is the basis? Is it vaccine safety? Is it mistrust of the system? To listen to their issues and why they're hesitant, and then to give them information and try and answer their questions and address their concerns so that they'll have the best information possible to make a decision that will help them stay healthy. It would be terribly ironic and unfortunate if those communities that have already suffered disproportionately due to COVID-19 didn't take advantage of the vaccine, which could help them avoid ongoing illnesses, hospitalizations, and deaths, particularly at a higher rate than the rest of our community, because of issues that we could have addressed. And so I really appreciate the types of things that Dr. Getaneh and her team at ICHS are doing. We are also doing similar outreach in the community, providing information in doing listening sessions, having information available in multiple languages, working with community task force, faith-based and small business, working with other community partners outside of the healthcare system to understand those concerns, their needs, and try and provide them with good information and whatever it is we can do to address their concerns and their needs so they will feel comfortable. But, we can't and don't want to, push vaccine on people who aren't ready for it or who don't understand why they should have it. We want to help them understand the benefits and let people make informed choices.
Got it. Dr. Duchin, I'll stay with you and look at the other side of the spectrum here. The state's been working on this phase finder tool so people can see what phase we're in to figure out when they should get vaccinated based on age and medical issues. I actually tried using the beta version of this online. It appeared to be pretty easy to lie about my age and my medical condition and get approved to be in line for the vaccine early, as it were. I know you've raised some concerns about this. Can we rely on this online honor system of the phase finder to prioritize who gets the vaccine?
Yeah, it's a difficult thing, but we are in the state using an honor system for certain indications. Now, obviously, if we've got an age-based indication of 70 and older, for example, which is coming up in one of the next phases, that's easy to verify, identification of age. And if we have an age-based criteria, which are part of many of the future phases, that's something to verify. But there are other things like essential worker status and member of a household with more than one generation where a family member can't take care of themselves independently and needs provider support and so on. Those things are hard to verify, and we don't want our vaccinators to be put in the position of having to validate. We will have to accept people's statements that they are indeed in the eligibility group. And ultimately, we do want everyone to be vaccinated, and we're hoping that the majority of people will adhere to the guidance that the state has issued to present for vaccination in their eligibility honestly and wait their turn. I haven't been vaccinated yet. I'm very much waiting anxiously. I want my turn to come up, but I don't want to step in front of someone else who's at higher risk. I can work from home most days, as many days as I need to, and others are out on the front lines at higher risk, and so I'm waiting. And I encourage my fellow residents to be patient. We always knew this was going to be a many months process, and we're not yet even through the first month.
Dr. Getaneh, let me follow up on that idea here with the vaccine rollout. This idea of prioritizing families with multi-generational situations there, I'm wondering about how that affects the ICHS system, because I think you have a lot of clients who might have that type of situation going on at home. Do you have the capacity to get those families vaccinated as we start moving into the next couple weeks here? Let me know about that piece, please.
Our public health partners have thought a great deal about this, and it's very important to get those individuals that need to be vaccinated first, get vaccinated first. Having said that, we are a healthcare organization, and we don't always ask if patients live in multi-generational homes. We have the patients, their age, their medical conditions, and we can risk stratify patients based on the information that we have. So this will add another layer of data collection that we don't really have the capacity for at the moment. So making it a simple tiered system would help us get to as many patients as we can in a very short period of time. Like I said earlier, we have a tool that we've used, and we have now in the queue about 6,000 some patients that have multiple medical conditions that will make them susceptible to severe COVID infection. If we can get to them as fast as we can, I think we'll do better. And I understand that there is a vaccine supply issue as well, and we are not sure when the federal government will send additional supplies and in what frequency. So I understand the public health position, but from a clinical, from our health center perspective, the simpler the tiered system, the better it is. So having an age cut point for us is simple. We know who should be in the first queue, who should be in the last queue.
Right. right. There's a lot of complexity here. And I want to talk about one piece of it with you, Dr. Duchin. That's an important part of the first phase of the state's vaccine rollout here, helping people who are homeless to get vaccinated before most of the general population here. Talk about this, the county's plan, how's this going to work, and how tough is it going to be to connect with an often transient group of people here for not just one, but 2 shots of vaccine?
Yeah, it is a great challenge. We've had an ongoing immunization campaign for people who've been experiencing homelessness because of a hepatitis A outbreak that started over a year ago. And we've been rather successful. Our rates of hepatitis A have come down, but that disease is not as readily transmitted as COVID-19. And this COVID 2-dose series is going to be very challenging. So our approach will be mobile teams to try and reach people where they are, whether they are in congregate shelters or living unsheltered. And we will be responsible, obviously, for tracking who we've vaccinated and when they're due for another dose. And the challenge will be trying to find people again for that second dose. We hope to. Many people sometimes are difficult to contact when they're living homeless, and so we're going to have to be very creative about finding ways to remind them of their appointments and hope that they come for their appointments. But there's no outer limit for the date at which a second dose can be administered. It should be administered as recommended on day 21 or 28 after your first dose, depending which formulation you get. But if you miss that date, you can still get your dose when you're ready for it, when we are able to give it. The congregate settings are in one of the future phases. They're not in the first phase. So the first phase was frontline healthcare providers and people living in long-term care facilities and caregivers in long-term care facilities. Right. So we'll be moving towards some of these other groups at the direction of the State Health Department in the coming weeks.
Got it. Thank you very much for that. Dr. Getaneh, back to you on this one. About 1 out of 10 patients who come to ICHS are homeless. I wanted to talk about what you might be doing to reach out to these patients. Do that in a safe way? Is there some extra training needed there too? Do you get mobile? Let me know about this homeless piece, please.
We have a cadre of staff who work in the community. These are our community health specialists and community outreach workers. We do have a collaborative relationship with mental health centers as well. So many of our patients have dual diagnosis, and so we do rely on our community outreach as well as our partners in the mental health centers to get at the homeless population.
Got it. Thank you very much for that piece. Dr. Duchin, I wanted to talk to you about something that we've seen a lot in the headlines recently, new strains of coronavirus popping up around the world, in the UK, South Africa, and in our country too. Can you try to tell us what these strains mean? How much of a concern are they? I know this is news that's changing quickly, but please try to tell us something about this.
Sure. So viruses mutate naturally. Many mutations don't really affect how the virus behaves or the type of disease it causes, but some do sometimes. And recently, there have been what are called variant strains, new strains of coronavirus that were initially detected in the UK and South Africa that spread much more effectively. That basically means they're more contagious. So if I'm exposed to someone with COVID, I'm more likely to catch it with a new strain than I would be with one of the pre-existing strains. And I'm also more likely to spread it to others. So what that means is the basic COVID-19 prevention measures that we've been using are also effective, will continue to be effective, but we need to be better just to keep the same levels of transmission. And we need to really be prepared for a very fast spread of COVID-19 when these variants become prevalent here or more common. They are in 10 states. They've been documented already in the US. I would not be surprised at all if these variants were in Washington State or here in King County. I think over time we will find them and they will become more common, which means we're going to have to get used to dealing with a virus that's become smarter. So we're going to have to work harder to stop the spread. And that means we're going to have to continue to take very seriously decreasing our activities outside the home to the extent possible, wearing masks and snug fitting, well made masks, 2 layers at least if possible, avoiding crowded indoor air spaces, and paying attention to ventilation, both in the home and in the workplace, and then continuing to use good hand hygiene. And ultimately, vaccine will be the best tool we have, but that will not be available to enough of us quickly enough to mean that we don't have to pay attention to these other COVID-19 prevention steps, because these variants are here now and they'll be spreading quickly.
Got it. Dr. Getaneh, I want to follow up with you on this briefly. Starting January 26th, people traveling into the United States will need to prove they've had a negative COVID test. I bring this up because ICHS, it's in the name, it's international here. What are you telling your patients that have these different international connections?
Right now, we do advise people to get testing. We do symptom checks before they come to work. Make sure that when anybody that has traveled is reporting to their supervisor and assess their risk. I have recently traveled out of the country in October, and I had to have testing both ways. So when I left to enter the country that I went to, and when I came back, and I think it's a really great preventive measure to do that. It doesn't completely protect us, but it is one of the steps that we need to take.
Absolutely, absolutely. And Dr. Getaneh, we need to start wrapping up here. If you could make this a 30-second answer, I'd appreciate it. Just in finishing up, are you optimistic we're going to see that 70% mark reached here in terms of people in our region getting COVID vaccinations? Are we going to get that herd immunity by this fall? Any thoughts out there? It's the big question everyone's asking.
I think you're going to have to rely on Jeff's answer on this. Okay. But if you were to ask me, from our community health system perspective, we have 29 community health centers across the state, 350 sites. And if the Department of Health deploys each one of them, we will be able to vaccinate 90% of the population in Washington state.
Okay. All right. Dr. Duchin, I'll give you the last word there. Are you feeling positive about getting people vaccinated, getting to that 70% mark by this fall, trying to get things back to normal, kids back to school, et cetera?
I'm feeling very optimistic. People understand that we've got incredibly effective vaccines right now, and I just wish we had more of them. I think over time, as more people get vaccinated and others see that the vaccine is safe, that it's effective, it's preventing illnesses, hospitalizations, and deaths. More people have died of COVID-19 since this outbreak started than died in the past 10 influenza seasons combined. This is a disease we need to stop, and vaccine is our best tool to do that. It can't be our only tool right now because of the supply issues, so we need to take all steps. And remember, it spreads from people who don't know they're ill. They look well, they feel well, they can still spread it. So you need to take precautions at all times and don't let your guard down. But we will get there, and we have a very good tool to help us. We will get to population immunity.
Okay, thank you very much, both of you. And we will be right back. What are people on social media saying about this issue? One person writes, homeless people should get the vaccine before anyone. Another writes, just heard a person who I thought was fairly intelligent denounce the vaccine as a fake remedy. The poison of disinformation in this country runs deep. We'd like to know what you think. Send us an email at contact@seattlechannel.org or find us on Facebook, Twitter, and Instagram. Coming up next time, taking on police accountability. State lawmakers want to ban chokeholds and tear gas, decertify officers for bad conduct, and require officers to intervene when they see their colleagues using excessive force. Is this the year of significant police reform? We'll bring you the latest from Olympia and what that means for Seattle next time on City Inside Out. I hope you join us.